Another application of the ultra-premium photon laser is in the field of internal medicine. Physicians working in various branches of internal medicine can benefit from this technology. This technology can be used for treating allergic disorders, hemorrhoids, and ulcers. For example, in ulcer treatment, the PhotonCare laser can be used to irradiate the affected area. This device can also be used in the treatment of asthma and COPD. Asthma and COPD can be treated using sublingual laser therapy or intravenous lasers. This technology can also be applied in the treatment of mucous wounds. Acute wounds can also be treated using the laser shower. The device can be used for sinusitis as well, where the optical fiber is inserted directly into the nasal cavity. The optical fiber passes through the nasal space to reach the nasal mucosa. This method is also applicable for both acute and allergic rhinitis. For diabetic rehabilitation, laser therapy can also be applied systemically. In these cases, IV lasers or sublingual lasers can be used. For other applications, including sublingual therapy, patients with metabolic disorders or diabetes can receive appropriate settings based on their BMI. Patients with fatty liver disease can also benefit from this technology systemically. This technology can also be used for IBS and radiculopathy. Next, you will see its application in the treatment of fissures and hemorrhoids. For example, if your patient suffers from hemorrhoids, you select the internal medicine option. You connect the dedicated hemorrhoid applicator, select the hemorrhoid option, and then press Start. In this case, the laser is delivered through the applicator into the rectum canal to perform irradiation. However, for patients suffering from internal wounds, such as gastric or intestinal ulcers, and when mucus band treatment is required, in internal wounds where the target tissue is the intestinal or gastric mucosa, the dedicated PhotonCare applicator can be used along with sterile, disposable optical fibers of various lengths. In these cases, the physician can pass the optical fiber through an endoscope or colonoscope to reach the internal tissues of the body.